Good morning. I am Maddie Jackson.
And I'm Claire Conlon, and we are a part of the sports medicine program here at the University of Southern Mississippi.
As a part of the Southern Mississippi Sports Medicine program, we have learned about different diseases and injuries that affect the body throughout the semester.
In this presentation, we will be discussing a case study about a parasite that infected the skin of a 20-year-old volleyball player that travels the world to participate in tournaments.
In our case study, a female Polish volleyball player participated in a world tour in Asia in the previous month. When returning home, the athlete noticed some spots on her legs. When she went to the doctor, she was diagnosed with allergic reactions and treated with antihistamines.
During a routine medical exam, her doctor noticed migratory serpiginous skin eruption on her legs, where she was previously diagnosed with allergic reactions that had not reacted to her treatment. She was then diagnosed with cutaneous larva migrans and treated with albendazole and cetirizine for 2 weeks, as well as liquid nitrogen freezing on the infected skin. After her treatment, she found the infection had resolved.
As seen here, the rash occurred on the patient's thigh and lower leg, which is one of the more common areas of infection. Other high-risk areas are the buttocks and feet. They are less likely to be found on the upper extremity areas, such as the arms, elbows, breast, and back. The rarest areas of infection are the face, scalp, genitals, and mouth.
While reading through our case study, we have learned many valuable takeaway points. First, when an athlete returns from tropical regions with a pruritic, serpiginous rash that does not improve with antihistamines, providers should strongly consider a parasitic cause, including cutaneous larva migrans. Second, organizers of international sporting events, especially those held in tropical or subtropical areas, should ensure that designated tan facilities are protected from cats and dogs, since these animals can carry and transmit parasites.
Finally, there is a clear need for more formal guidelines on sand protection and hygiene practices in sports, which would help reduce the risk of parasitic infections in athletes competing worldwide.
Overall, this case highlights how environmental exposure plays a major role in an athlete's health, and why awareness of parasitic infections is essential in sports medicine. Early recognition and proper management can make a significant difference in recovery.
As future medical professionals, understanding conditions like cutaneous larva migrans help us better protect our athletes and keep them performing at their best.
Thank you
for listening to our TED Talk.